The late March night rain in Atlanta fell quietly on the bare trees outside the hospital courtyard. Inside the obstetrics department of Grady Memorial Hospital, the delivery room lights glowed bright white, reflecting off the tense faces of the on-duty team, the air thick with urgency and weight. Jordan Lee, a second-year resident, stood by the operating table, eyes fixed on the fetal heart monitor. The steady waves suddenly faltered. A long pause. He blinked, thinking it was just a technical glitch, but seconds passed and the line remained perfectly flat. A nurse hurried to adjust the sensor, but the small shake of her head made everyone freeze. The line stayed still, like a thin, cold strand of white. The delivery room door swung open. Helen Moore stepped in. One glance, and she understood what had just happened. Without a word, she approached the mother, a young woman with sweat-matted hair, her eyes a mix of panic and despair. Helen placed her hand on the woman's forehead, warm and gentle enough to make her shiver. "The baby's heart is gone," another doctor murmured, as if afraid to disturb something fragile. Jordan watched Helen. He had seen her remain calm through cardiac arrests, had seen her make split-second decisions when two lives hung by a thread. But this time, Helen stood still. She bent down, took the mother's frail hand, her own fingers trembling slightly. Seconds later, tears welled in her eyes, not the quiet kind, but sobs, raw and choked, as if she herself had just lost this child. "I'm sorry. I'm so sorry," Helen whispered, her voice breaking. "I truly am." Jordan was momentarily taken aback. In his mind, this was not something a doctor should say. A physician was meant to be the pillar, the wall that held firm. He had never seen an experienced doctor let their emotions sweep them away like this, right in the middle of surgery. The lessons he had been taught echoed in his head. A doctor must control themselves, never let emotions interfere. But before him, Helen gripped the mother's hand tightly, crying with her, without the slightest attempt to hide it. The atmosphere in the delivery room shifted. The sound of rain outside seemed closer, clearer. The whole team worked in silence, broken only by the mother's sobs and Helen's uneven breaths. As she delivered the baby, Helen murmured, "I'm here with you. I'm not leaving. We'll bring your baby out so you can hold him in your arms." Jordan stood behind, assisting. He followed every protocol, monitoring blood pressure, reminding the nurse to prepare the medication, keeping his voice steady. But inside, he was unsettled. Why would a seasoned doctor like Helen allow herself to cry? Why place herself inside that pain when her role was to keep her distance and remain clear-headed? Yet he could also see every word, every tear from Helen seemed to give the woman a little more strength to endure the pain. He had never thought a doctor could become an anchor for a patient simply by hurting alongside them. And when the baby, still silent, was laid in a white cloth, Helen bent down and kissed its forehead, an act no medical school ever taught. She placed the baby into the mother's arms, for her to hold, for the first and last time. The delivery room was wrapped in a silence that was both tender and heart-wrenching. Jordan felt his chest grow heavy. He remembered the hours of medical ethics lectures where they taught to empathize just enough to avoid emotional burnout. But could just enough ever fill the void in a heart that had just lost a child? He had never asked himself that. A doctor sobbing openly during surgery, not pretending to be strong, not building a wall of detachment, and somehow that made the room feel a little less cold. When the delivery was over, Helen removed her gloves, her eyes red, her cheeks still wet. She said nothing, only placed a hand on Jordan's shoulder before stepping out of the room. That light touch left him unsettled, as if she had just passed him a message no textbook could ever teach. In the hallway, their footsteps echoed. Jordan wanted to ask, "Have you ever lost control like that before?" But he stayed silent. Something in that moment told him this wasn't losing control at all, but a choice to be human before being a doctor. Outside, the rain still fell. Inside Jordan, for the first time, a small crack formed in the wall he had built between himself and his patients. Many mornings later, April sunlight filtered through the windows of the obstetrics ward, laying a pale golden sheen over the gray plastic chairs in the waiting room. But inside the consultation room, the air was thick, as if a storm was about to break. Jordan sat across from Helen, eyes fixed on the medical chart of a patient admitted to the ER at dawn. She was only 24, pregnant for the first time, single, and at 30 weeks. Diagnosis, severe preeclampsia. Her blood pressure had spiked dangerously high, protein levels in her urine were elevated, and her whole body was swollen. Worst of all, without an immediate C-section, both mother and baby were at risk. But operating now meant the baby's chance of survival was very low. The standard protocol, Jordan looked up, his voice steady and firm, is to prioritize saving the mother. Terminate the pregnancy as soon as possible. Helen sat opposite him, hands clasped, gaze drifting toward the window. I know. But have you heard the patient's story? Jordan frowned and replied, I don't think emotions should influence medical decisions. Helen turned back to meet his eyes. She's had 2 failed IVF attempts. This time is almost her only chance at having a child, and she knows the risks, but she's still begging to keep the baby as long as possible. Jordan exhaled quietly, his voice dropping. Helen, we can't risk the mother's life for a fragile hope. She didn't argue right away. Instead, she pulled an ultrasound film from the chart and set it in the middle of the table. The image was blurry, but Jordan could still make out the tiny heartbeat pulsing between the black and white shadows. That heartbeat is her whole world. Sometimes you have to look at the bigger picture, where numbers and risks are only part of it. The rest is the patient's story. The consultation ended with an unusual decision. Give the patient another 48 hours, using a high-risk treatment protocol to keep the baby in the womb as long as possible, while monitoring closely. Jordan wasn't satisfied, but he couldn't object when Helen took full responsibility for the choice. 2 days later, Jordan stepped into the patient's room. The young mother lay there, her face pale, but her eyes strangely bright. On the bedside table was an old ultrasound photo, its corners worn from being held too often. Hello, doctor, she said with a faint smile. Dr. Moore told me I get to stay with my baby a little longer. Jordan stood still for a moment, unsure what to say. He didn't want to give false hope, but the way she clutched the photo, as if holding her whole future, made it impossible to break the moment. The surgery began on the morning of the 3rd day. The operating room lights blazed white, reflecting off the sweat on the team's foreheads. Jordan stood to the patient's right, Helen on the opposite side. The patient's blood pressure fluctuated, the monitor beeping in fast, urgent bursts. Every abnormal reading from the baby made the air in the room feel frozen. We're hitting the danger zone, Jordan said, his voice taut. Helen didn't take her eyes off the patient. Just a little longer. We've come this far. Don't give up now. The moment the baby was delivered, the entire room held its breath. Then came the cry, weak but clear. Jordan let out a quiet exhale and quickly passed the baby to the neonatal resuscitation team. Helen leaned toward the mother, took her hand, and murmured, You've both made it through. Tears welled in the mother's eyes, her lips trembling. Thank you for seeing me not just as a patient, but as a real person who needed help. Jordan stood there, hearing the words echo in his head, not just a patient. He realized that in all the charts, numbers, and prognoses, he had never truly looked at someone the way Helen just had. After the surgery, when everyone else had left, Jordan and Helen walked out of the OR together. They said nothing on the way to the doctor's lounge, only the sound of their shoes on the tile floor filling the quiet. The lounge was small, with a low ceiling, carrying the mingled scents of old coffee and antiseptic. A single yellow bulb hung overhead, its light just enough to see by, but warm and dim, as if urging people to lower their voices. Helen sank into a chair, leaned back against the wall, removed her surgical cap, and let her hair fall loose from its knot. Strands of salt and pepper hair tumbled messily over her shoulders. Jordan poured himself a glass of water, sat across from her, and glanced at his hands, still marked from the pressure of the surgical gloves. They sat in silence for a long while. Jordan rolled the glass between his palms before blurting out, almost without thinking, Do you ever get tired of having to care about every word, every look in front of a patient? Feelings are messy and exhausting. Helen looked up at him. In her eyes, catching the glow of the yellow light, was something both gentle and weary, as if she had heard that question from her own mouth many years ago. I used to be you, Jordan, she said with a faint smile that carried a hint of sadness. In my first year, I believed keeping my distance was the way to survive. I thought if I didn't let patients touch my heart, I wouldn't be hurt when things went wrong. I lived like that. Until one night. Helen's gaze drifted to a far corner of the room, as if looking through the walls, back to a moment etched deep in her memory. That night, I was on call in the ER. A woman pregnant with twins was brought in, one baby still alive, the other already gone inside her womb. When the surgery ended, I handed them the surviving baby. The mother held her child and wept, while the father stood silently beside her, his hand resting on her shoulder, saying nothing. Back then, young and confident, thought my job was to remind them of the positive. I said, "We're so sorry, but your other baby is healthy. You should thank God for that." Helen paused, her fingers interlaced, giving them a slight squeeze. The mother didn't say a word, just clutched her baby tighter. And as I stepped out, a nurse, someone who had worked here for many years, looked me in the eye and said very plainly, "She doesn't need advice like that, Helen. She needs someone to share her grief." Jordan didn't move. He heard every word, every pause in Helen's voice. I was unsettled for a whole week. I didn't fully understand it then, but that sentence clung to me like a thorn. A week later, I wrote a letter of apology, admitting I was wrong for not sharing in their pain, and sent it to the address the hospital had on file. No one replied. Helen exhaled, a long, weary breath. I thought that was the end of it, but 2 years later, that same mother came back to the hospital, pregnant again. She sought me out, asking me to care for her pregnancy. When I asked, why trust someone who had once hurt her, she said, "I forgave you because I knew. What made you send that letter was your humanity." She turned back to Jordan. From that day on, I understood. Keeping your distance might help you survive, but stepping into a patient's pain is what helps you truly live. Jordan sat still, but inside, something was shifting. He remembered his first weeks at the hospital as a resident, telling himself, "Never let a patient see your heart. Keep it behind the white coat." And he had managed until he met Helen, and until the days they had just shared. He recalled Helen sobbing openly in the operating room last month, the way she had risked a high-stakes approach to give a single mother a little more time. And now, hearing her past, he realized she wasn't born this way. She had once been him, believing that detachment was a shield. Jordan looked at her and saw not only a skilled physician, but also a person who had stumbled, regretted, and chosen the harder road, the road of empathy. After a pause, Jordan spoke softly, almost like a confession. "Maybe. I'm afraid. Afraid that if I let myself feel all of a patient's pain, I'll break." Helen smiled slowly. "You will break, Jordan. We all have. But then you'll stand up, and when you do, you'll be different." Inside Jordan, something hollow felt as though it had been filled, not with an answer, but with a direction. A few days later, in the obstetrics ward, the pace was more urgent than usual. Jordan moved quickly down the hallway, patient chart in hand. He had just received the case, a 39-year-old woman, pregnant for the first time after years of infertility treatments and failed IVF attempts, 37 weeks. Labor had begun, but the fetal heart rate was unstable. When he entered the operating room, Helen was already there. But today, she stood in a different spot, at the back, in a supporting role. Their eyes met, calm but full of meaning. Jordan took a deep breath. He knew the weight of this moment. This woman had endured dozens of hormone injections, hundreds of days swinging between hope and despair to have this child. And now, every beat of the baby's heart was as fragile as a thread. The operating lights blazed, the white glare almost icy. The monitor beeped steadily but with irregular dips. A nurse reported the mother's blood pressure was fluctuating, the baby's oxygen levels falling. Jordan issued orders, his voice clear, his hands steady, but inside, every nerve was drawn taut. As he made the first incision, he caught sight of Helen, quietly observing. She didn't interfere, simply watching each of his movements. In his mind, her words from that night echoed. Stepping into a patient's pain is what helps you truly live. The moment the baby was delivered, silence. No cry, a faint, weak heartbeat. The neonatal team immediately began resuscitation, working to support the baby's breathing. The air in the room thickened. It felt as though everyone had stopped breathing. Jordan's chest tightened. Instinctively, he started to turn to the mother to give the standard update. "The baby needs respiratory support. We're working on it." But then his eyes met hers, wide, terrified, searching for something to hold on to. And in that instant, he knew. A technical report wouldn't be enough. He stepped to her side, placing his hand over hers, ice cold from blood loss and fear. He bent down, meeting her gaze, making his voice deep and steady but full of presence. Your baby is fighting for every first breath, so are we, and I promise, I won't leave your baby until she is truly ready to cry. Her eyes brimmed with tears. Maybe she didn't hear every word, but what she received was a promise given with an entire heart. Jordan turned back to the resuscitation team. The seconds that followed stretched endlessly. He watched every chest compression, every assisted breath. In that moment, memories of Helen, sobbing with a mother who had lost her child, fighting to give a single mother one last chance, rushed back to him. He saw himself months ago, standing silent in the corner, holding fast to his distance. And he realized now he had crossed that line. Then, a cry rang out, at first faint, then growing louder, as if tearing through the heavy air that had been pressing over the room. A few nurses exhaled softly, some smiling through tears. Jordan felt the weight lift from his chest. He turned to see the mother, sobbing, her trembling hands reaching for her child. Jordan carried the baby closer, letting her press her lips to the baby's cheek for the first time. "Hello, my love." Her voice blended with the baby's cries, creating a sound that could only exist in moments where life and death had just brushed past each other. Helen stepped forward and placed a hand on Jordan's shoulder. No words, but in that gentle squeeze he felt her recognition and her pride for the doctor she had helped him become. That night, when the hospital had grown quiet, Jordan sat alone at the duty desk. Before him lay an old notebook where he recorded his most meaningful shifts. He opened to a fresh page, pen touching paper. "I once learned to stay silent in the face of another's pain. Today, I learned how to let my heart speak, and that healed not only the mother, but also me. Sharing in a patient's pain with presence, emotion, and humanity is sometimes the only thing they need in a moment between life and death." He set down the pen and closed the notebook. Helen had once told him, "Stepping into a patient's pain is what helps you truly live." Now Jordan knew it was a truth he would carry for the rest of his life.